My name is Amy Archibald Varley, and I'm a nurse. And with my colleague Sarah Fung, we are political, social activists, and nursing advocates. Nurses during this pandemic have been hailed heroes, but we have not been treated that way. The lack of transparency during the pandemic has caused many nurses to lose trust and faith in our government and our hospital organizations and leadership. Nurses are considered to be the backbone of healthcare, but our voices have been noticeably absent or silenced from many healthcare decision-making tables. Representation matters. We cannot turn a blind eye to the mental health crisis that looms overhead for healthcare workers. Nurses are frustrated, scared, and burnt out. In the spirit of Black History Month, Martin Luther King Jr. said, "The time is always right to do what is right." We still have time to make things right. Thank you. I will now ask Dr. Alika Lafontaine to start us off with the land acknowledgement.
Thank you for the invitation to offer the land acknowledgement on behalf of everyone gathered here today. I acknowledge the unceded and unsurrendered lands of the Anishinaabe Algonquin from which the Prime Minister and Health Minister meets with us today. For other participants who live, work, and play on traditional territory that lies within Treaty 1 through 11, modern treaties, Métis settlements and homelands, and Inuit territories and homelands, we open our hearts and make space to include the needs and priorities of Indigenous people, as well as others whose voices might be missing around this virtual table. In the many discussions I've had with elders, Indigenous leaders, colleagues, and patients in the midst of this COVID pandemic, the theme of trust is one that permeates our conversations. When new faces enter a community, why are you here? What is your intent? Are you going about your activities in a good way? As you will hear today, the way we go about COVID-related activities is just as important as the activities themselves. What is the role of the patient, community, political leader, nurse, physician, etc., as we move forward in a good way? As we acknowledge the traditional territories, treaty nations, and homelands we enter in addressing this pandemic, what is the role of those who already live in these spaces? Do we see ourselves as visitors who are graciously welcomed, or do we see ourselves as entitled to implement our own plans and actions unilaterally? We have all been disempowered by this pandemic. Those who were already disempowered have been affected more deeply. This crisis is an opportunity to address this differential disempowerment in a new way. Empowerment can be achieved through the steps of reconciliation, speaking the truth even when at risk, accepting the truth even when unpalatable, actions that repair relationships even when difficult, moving forward in a new way with a new perspective, co-creating a different future. I encourage the Prime Minister and Health Minister to consider the importance of the skills development and training that goes hand in hand with building community capacity to solve their own problems. No space will be trusted more than those that already have earned patients' trust. Community-based health clinics, friendship centers, schools, and gathering places are places where patients already feel safe and comfortable. Investment in training to enhance the local skills of health directors, community leaders, healthcare workers, and patients will yield long-term benefits mid and post-pandemic. I also encourage you to consider further investment in digital connectivity, specifically broadband and satellite-based internet. As health systems further expand into virtual care and digital health records, this connectivity is central to ensuring a coordinated COVID response. In accepting this land acknowledgement, may each of us remember that we are just one of many voices that need to be heard to properly address the issues we'll discuss today. Miigwech, hi, Marci, Maloa Pito. Thank you.
Miigwech, thank you. Thank you, Dr. Lafontaine. I'm delighted now to introduce the Honorable Patty Hajdu, our National Minister of Health, who will speak, followed by our Prime Minister, Justin Trudeau.
Well, thank you to all, Dr. Kaplan-Murth, Amy, and Dr. LaFontaine for the land acknowledgement. I too am speaking to you from traditional territory, the Anishinaabe people of the Robinson Superior Treaty area, and of course, many contributions by the Métis to this area as well. So thank you for reminding us of the importance of working in community. Dr. LaFontaine with community, letting community lead, all really wise reflections so far. I'll just say very briefly, we don't have a lot of time. I first of all just want to profoundly thank you and thank the organizers, who I understand had an unusual route to getting the Prime Minister to attend this event, but congratulations on your creativity and your persistence. And I'm thrilled to announce or introduce the Prime Minister of Canada, Prime Minister Justin Trudeau. He has been a staunch ally of mine certainly this hasn't been an easy 14, 15 months as the Minister of Health in the middle of a pandemic with a very small but now burgeoning Public Health Agency of Canada. And he has supported me and encouraged me all the way through. And I want to thank him profoundly for that. So you have the right person listening to the concerns that you have around the vaccine rollout, and your thoughts and your innovation are all welcome. Thank you so much. And the Prime Minister.
Thank you so much, Patty. Hello, everyone. It's great to be here with you all. Dr. Catherine Mirth, Mrs. Varley, thank you for having us. Dr. Lafontaine, thank you for that land acknowledgement and the reminder of the frame we need to put on our reflections and our discussions. Thank you all for taking time to share today. I know that you've been unbelievably busy as frontline heroes, not to say it too many times, but we really, as Canadians, have been so extraordinarily fortunate to have amazing leaders across the healthcare field there to support, to serve, to lead, and to make sure we're getting through this all right. À chaque jour, vous travaillez aux premières lignes pour prendre soin des plus vulnérables. C'est grâce à votre travail acharné et vos sacrifices qu'on est en mesure de traverser cette crise. Je parle au nom de tous les Canadiens en vous disant qu'on ne peut pas vous remercier assez. Now, right now, cases of COVID-19, we're seeing they're dropping in many places across the country, and that's good news, but it doesn't mean that your job's getting any easier. We know that even as we're seeing a decline in cases, we're seeing a rise in the new variants that are going to mean a lot more transmission and a different phase that we're getting into. And it's very much a race between the variants rising that we need to hold on to and keep strong for the next number of months as we ramp up vaccinations into mass vaccinations. But every step of the way, our government has worked with the provinces and territories and worked directly with you to try and support you every single bit as possible. So as long as this crisis lasts, this government will continue to be there for you. We've delivered millions of pieces of PPE to the provinces and territories. We've delivered more than 19 million rapid tests to the front lines, with millions more on the way. And we know that we need to do a better job on testing and testing creatively and testing often to help you do your jobs, to keep people out of the ICUs. I'm looking forward to hearing perspectives on that. But I certainly don't need to tell you that vaccines are our path through and out of this crisis. Since Canada first approved the first COVID-19s in December, vaccines in December, we sent over 1.2 million doses to the provinces and territories. You're on the front lines of this pandemic, so you know exactly why it's key to prioritize the most vulnerable and healthcare workers for vaccination first. This week, we received tens of thousands of Pfizer doses, with hundreds of thousands scheduled to arrive weekly starting next Monday. We're on track to have 6 million doses from Pfizer and Moderna by the end of March. And as I've said many times, by September, we will have enough doses to vaccinate every Canadian who wants it. Right now, we're all very aware that we need more vaccines and we need them quicker. And I know all of you are working very, very hard to get those most vulnerable people, to get your colleagues on the front lines vaccinated as quick as possible. And because of global production challenges, there's been a few weeks of slightly fewer vaccines coming in than we'd like. But we're approaching something that we're calling the big lift, which is the phase in which we go from vaccine scarcity, as we are right now, to receiving millions upon millions, even tens of millions of vaccines into the spring. And we're going to have to make sure we're getting them out to everyone. And that means, expanding to all sorts of different methods of delivery. The different vaccines have different requirements, making sure that we are giving citizens confidence in the structures and the process and the safety of vaccines, and making sure we're not missing anyone. As we saw from previous health crises, the people who are always pushed to the sidelines tend to get further pushed towards the sidelines by crises. we need to do a real focused job together on making sure that the most vulnerable, I'm not just talking about the elderly, I'm talking about racialized Canadians and vulnerable populations that we've seen have been harder hit by this virus, also are prioritized in everything we do. So I'm looking forward to hearing from you all on how we can be better partners at the federal level, but also what kinds of things you think would be good for me to pass along to the premiers as I meet with them every other week and we talk about the challenges we're facing. Being able to hear directly from you right now is going to help us all make sure that we're delivering properly for Canadians, keeping their confidence in our system strong, and mostly looking forward positively towards a better future in the coming months. Alors, merci tout le monde. J'ai hâte de vous entendre dans vos perspectives et votre expérience. Merci encore pour tout ce que vous faites. Et je retourne la parole maintenant à la Dr. Kaplan-Myrth et à Madame Varley.
Thank you, Minister Hajdu, and thank you, Prime Minister Trudeau. We will now turn to our first topic, strategic challenges and the need for local understanding and national standards. We will hear from 6 panelists and then from the Prime Minister and from the Health Minister, and then they will have an opportunity to respond. I invite our first panelist, Dr. Lenora Saxinger, to begin. Dr. Saxinger is an infectious disease specialist in Alberta.
Hello, everyone, Prime Minister, Minister, and my thanks to you and the conveners for this opportunity. I'm an ID doc at the University of Alberta, and I've been co-leading one of the many scientific advisory groups across the country who are trying to advise our public health and health leaders on assistance in the pandemic response using evidence. And although we're still in the thick of it, I'm really looking forward at emerging challenges and possible federal-based strategies to limit our vulnerabilities. I mean, for vaccinations, we will be hearing more about vulnerable groups from this panel, and we'll need to make sure, very sure, that our response is coordinated well. Our future may involve a menu of vaccines that may be given in series to maintain population protection. We'll be challenged by people moving between provinces and communities, and by communities that have less access and less tracking infrastructure. So just being very pragmatic, to meet this goal, has there been discussion yet of revitalizing the idea of a pan-Canadian vaccination registry? And also, with the vulnerabilities of many First Nations and Métis communities, will vaccine rollout to those communities be coordinated directly from the federal government rather than being enmeshed in provincial disbursements? And then finally, my last big picture thought is, as we learn from this experience, which has been very disruptive, and look to design our post-pandemic future, do we have an opportunity to build a more pandemic-proof Canada? Right now, the public sees slightly different data reported in different ways and different control approaches between jurisdictions, and some of that is needed. But some of that may not be, and it's confusing, and it can actually increase mistrust at a time of high anxiety. We might be able to reduce duplicated effort and design federated structures to allow information flow between provinces and between these separate communities of practice, including many of the people here, policymakers, experts, and communicators. Is vaccine rollout perhaps the perfect test case for a network building exercise and development of a federal coordinating table to improve cohesion and public communication for the rest of the pandemic? That's
Thank you, Dr. Saxinger. And definitely, yes, this is our opportunity to network. We turn now to Dr. Amy Tan. Dr. Tan is a palliative care specialist and family doctor in British Columbia.
Thank you for the opportunity, Prime Minister and Minister, to speak to you today about the need for an anti-racist lens for the vaccine rollout for the general public currently being planned, in great anticipation to start as early as next month. This is to follow the high-risk groups for the early vaccines designated by the NACI ethical framework, namely long-term care, healthcare workers, Indigenous communities, and congregate living settings. While age is the most significant factor for the risk of severe disease, basing priorities solely on age does not take into consideration, unfortunately, the systemic inequities that racialized communities have to be more vulnerable. Some provinces like BC have announced plans for the public vaccine to be rolled out only on age. And so I'm calling for an explicit prioritization of vaccines for racialized communities made vulnerable by structural racism that persists in Canada today. I'm speaking particularly of how racialized communities intersect with low-paying essential work, precarious labor, and poor living conditions and healthcare. And we've seen an increased risk of severe disease from these communities due to COVID-19. Racialized Canadians, those who are Black, Indigenous, and people of color, especially Black, South Asians, and Southeast Asians, have been more exposed and less protected, thus disproportionately affected by the pandemic. Incorporating an anti-racist lens explicitly into the general rollout of the vaccines would help to avoid perpetuating these inequities. This would help to ensure justice as well, but we need a national document that can't be left for individual province interpretation or allow for the queue jumping that unfortunately we've seen by more privileged folks. We must build confidence as well in the vaccine in these communities by communicating with these communities in a culturally safe way and working within these communities to build trust. We must acknowledge the Indigenous and Black people's experience with healthcare institutions because of systemic racism. We have an opportunity to explicitly link public health with anti-racist strategies and to work to dismantle these inequities that unfortunately COVID-19 is shining a bright light on. Let's not squander this. Thank you very much.
Thank you, Dr. Tin. We now turn to Dr. Elizabeth Mugga. Dr. Mugga is a family doctor and the president of the Ontario Family Physicians.
Hello, thank you, Prime Minister, and thank you, Minister Hajdu, for inviting us. This is a delight. I thought I would start with a short story and follow with two opportunities. So as a family doctor, my day in the office is often filled with patients of all sorts, pregnant patients, elderly patients coming in with chronic illnesses, parents with concerns about their children. And these days, the conversations definitely turn to the vaccine. And we're being asked as family doctors by our patients, is the vaccine safe for me? How does my pregnancy or my illness or my age impact how the vaccine will work for me? Do you think, family doctor, that I should get this vaccine? So to me, these stories every day in our offices really highlight the unique role that family doctors can play. We have this trusted relationship with our patients that's been built because of the continuity of care that we provide over the lifetime. And with that trust, we can then really help build that confidence that patients need to have in the vaccine. And I would say in addition to that, around the education, family physicians and primary care writ large can really be the linchpin for the delivery of the vaccine. So this is our bread and butter. We know how to vaccinate. We know how to do it safely. We can identify those patients who are most vulnerable, reach out to them, ask them to come into our practices. And if they can't come to us, we can go to them, either through home visits or by participating in the community-based rollouts, the mobile clinics and the mass vaccine clinics that we're seeing. So the opportunities to me, and this builds very much on what we just heard from Dr. Tan and Dr. Saxinger. First of all, in the short term, let's really be sure right across this country that we are leveraging the relationships, the institutions, the systems in family medicine and in primary care. And second, as we build back better and look at pandemic proofing, let's make sure we're investing in family medicine and primary care. And specifically, I would point to the patient medical home. And this is a model that is foundational to high-performing healthcare systems. And it's built on that trust and that continuity of care that I mentioned, with an interdisciplinary team and led by a family doc or a nurse practitioner. And right now, unevenly seen across the country. So is there not an opportunity now to take a look at how do we support the uniform adoption of this type of model? Thank you.
Thank you, Dr. Mugga. We turn now to Ms. Nancy Mike, a nurse in Nunavut. Nancy, unmute yourself.
Sorry about that. Would look good, Nancy yung Nancy Mike. My name is Nancy Mike, and I'm currently in Meahongo, Nunavut, and I work as a research associate of community and family health with Health here at the Rikirtani General Hospital as well, and a mother of 3 Indigenous girls. One thing that I'm realizing as we speak here actually is that the previous speakers just spoke out of privilege. You know, you have access to care, access to resources, and in Nunavut, I find that one thing that we struggle with for a very long time have been struggling with is that access, and being in a remote place that can be very challenging for many families and within the community as well. And one thing that I find with the vaccine rollout in Nunavut is that things are going really well in terms of delivering the vaccine and providing it to the population and having access to it. Except that I find that the Indigenous languages are not taken as a priority, and so the content or the information about the vaccine sometimes is delivered not in the way that Inuktitut first language speakers may not understand it fully. So that was a bit of a struggle that I saw when the vaccine information started being brought out. And then secondly, one thing aside from the vaccine, I guess one thing that I worry about is, I'll tell you a bit of the story of the woman that went to Winnipeg from Alviat Nunavut to deliver her baby and ended up contracting COVID-19 there and didn't make it back home and had passed away. That was one very hard experience for all of Nunavut. I'm sure all of Inuit were impacted by that. And so I think one thing that I would really, really like to hear from the federal government is to think about the access or the availability of healthcare in Nunavut, and believe in Inuit that we are capable, and education, you know, you can bring these accesses, healthcare into Nunavut in a way that we aren't relying on the southern part of Canada for the proper care that we need. And I think that it should be for the woman that had passed away for going down to the south to deliver her baby. That is very preventable, and that I believe that we are able to have these resources and ability to, you know, deliver a baby at home. And so I think that I look forward to hearing more of what the federal government will do for us who are living in remote communities, because I think we are all tired of hearing about, you know, having to go to the south or even using medical travel for these things that are much simpler than you think and can be, you know, available up here as well.
Thank you, Ms. Nancy Mike. We now turn to Dr. Courtney Howard. Dr. Howard is an emergency room doctor in the Northwest Territories.
I think you're on
Dr.
mute,
Howard.
It wouldn't be Zoom if we didn't all catch ourselves on mute from time to time.
Thank you for having us. And I wanted to say thank you, first of all, for the vaccine supply that's come our way. When I go work in the emergency department, we don't have any spare medevac planes, and that's really our limiting factor up here. So thank you. I also wanted to say thank you to you too personally. We talk a lot about burnout in medicine. I don't hear it mentioned often in politics, but I imagine there's been a lot of sleepless nights. So thank you for that work. And when I ask doctors up here what leads them to lose sleep, it's actually not only the vaccine supply, it's the supply of other essential medicines. We've had ongoing problems getting tuberculosis medicine, botulism antitoxin, basic generic penicillins, etc. And really, we'd like you to consider the fact that we're in what's essentially a planetary health emergency. This is an emergency that's been brought about as a result of a zoonotic virus transmitted into humans. And we know that climate change is going to make further pandemics more likely, as well as lead to further supply chain disruption. We had 2.5 months of wildfire smoke up here in 2014, and we just published a study that showed that we had a full twice doubling of emergency department visits for asthma, and one of our pharmacies ran out of salbutamol because the highway kept getting blocked due to wildfires. So we know we need to move to a culture of resilience. And when we look at what sort of kept us safe through previous emergencies, we see that Canada during World War I, World War II, some of the decades after, was really supplied with essential medicines, vaccines for diphtheria, and also tetanus, experimental vaccine for the Spanish flu, et cetera, by Connaught Laboratories, which was in fact a publicly owned laboratory. And so, anticipating a potentially rocky century, we're wondering if you would consider creating a publicly owned pharmaceutical company, call it Connaught Laboratories 2.0, to develop and produce essential medicines for Canadians so we can care for one another through the planetary health emergencies that the century may bring. Thank you.
Thank you, Dr. Howard. We'll turn now. I've lost myself. I am just, there we go. We'll turn now to Dr. Robin McQuarrie. Dr. McQuarrie is an obstetrician in Nova Scotia.
Hello, Prime Minister and Minister Hajdu. Thank you. It's my pleasure to speak with you today regarding COVID-19 and pregnant and breastfeeding women and vaccine administration in this population. With respect to COVID-19 infection, most pregnant women will have mild to moderate symptoms. Many are asymptomatic. Data suggests 8 to 11% will require hospitalization and 2 to 4% will require admission to an ICU. This is worse than their age-matched non-pregnant peers. Pregnant women in Canada have had to pivot their expectations around labor and delivery, given strict visitor restrictions. This is a vulnerable and challenging time for Canadian women, and they've had mixed responses to these regulations, many feeling unsupported and scared. With respect to the vaccine, the SOGC in Canada, the ACOG in the US, and the RCOG in the UK have all made similar recommendations that pregnant women should receive the vaccine as they become eligible. This is a challenge for these pregnant women who are being recommended to receive the vaccine in a setting that is untested. We need those governing clinical trials to mandate inclusion of pregnant women in clinical trials if they belong to the population vulnerable to the target pathogen. We must go further than the TCPS currently does. This is a policy that governs Research Ethics Board. We saw this exact same challenge play out during H1N1, Ebola outbreaks, and it's unacceptable that we continue to disenfranchise women at such a vulnerable time. In my remaining moments, I wanted to take an opportunity as a doctor from the Atlantic provinces and specifically Nova Scotia to share our experience with COVID. Very early in the outbreak, our government was quick to turn to the scientists and clinicians and implement strict restrictions, even though they were not popular with the business community. Similarly, a quick and robust response early in our second wave resulted in a very flat curve. Following aggressive testing strategies, even in the pubs and bars, for asymptomatic and symptomatic residents resulted in this flattening of the curve. The Atlantic provinces were strategic in working to support the economy, and the Atlantic bubble was created. For many months, we've enjoyed the ability to spend our tourism dollars in near provinces. We did have a significant outbreak in a long-term care site, but our mortality rate in this vulnerable population was 10%. As physicians in Nova Scotia, we are currently enjoying a strong and positive relationship with our government, and we believe that fostering these good relations and good support between the government and physicians and care providers has played a significant role in the positive relationships and our response to the virus. We were able to negotiate income stability packages in a supportive environment in the physician community. There's no doubt that the support from our government played a role in this collaborative environment and the trust in the scientists in Atlantic Canada. Thank you.
Thank you, Dr. McQuarrie. We've heard from 6 brilliant colleagues. We will now pause and ask the Prime Minister and Minister to respond to some of the ideas and questions that were raised so far.
Thank you very much. Obviously, I took a whole bunch of notes, as did I know Dr. Patty Hajdu, Minister Hajdu, and lots of things that we're going to want to follow up and dig into. But a couple of first off reflections. The Constitution, as you all know, mandated that healthcare be delivered by the provinces. And sometimes that's a really good thing because it allows provinces to align themselves on their priorities. We have a geographic diversity and a population diversity across the country that means that being able to meet the needs locally is absolutely the right thing. And we're lucky that provinces and territories have leadership on that. It also allows for sharing of best practices and a little bit of experimentation. If something worked really well in one place, we get to pick up on it. But as you also pointed out, sometimes we would benefit significantly from greater cooperation and collaboration. One of them, obviously, data sharing, being able to understand what's going on across the country and based not on just a small-ish sample from from PEI or Manitoba, or even the smaller sample that Ontario is than the entire country, to be able to see certain realities would be great. We've worked a lot on data sharing with the provinces. It's coming along, but of course, everyone feels like they have the right way to collect data. And sometimes it's not, retraining in the middle of a pandemic or changing our systems is a challenge, but I can assure you it's very much something that we are working on. The vaccine rollout does give us a bit of an opportunity as well, because the federal government decided we are paying for the vaccines, we're delivering them to the provinces, and that gives us a little bit of leverage or a little encouragement to say, no, let's make sure we're coordinating on tracking, on ensuring that, as you pointed out, Dr. Saxinger, if you move from one province to another, one area to another, we can properly flow. We know there's been a lot of work moving towards digital medical records, huge privacy concerns, huge, really logistical and pragmatic concerns as well. But we're heading in that direction, and the federal government, even though we don't deliver healthcare, does have a responsibility over healthcare through the Canada Health Act to make sure that all Canadians get the same quality or a level of healthcare that is equivalent across the country. And I'm ready to do that, obviously. Dr. Tan, thank you so much for bringing up the challenges around systemic racism and the intersectionalities that lead to much worse outcomes than in other populations or in majority populations. Again, we've done a lot of work with the provinces on it. I'm happy to move forward. When we came forward with a statement around systemic racism, it was something we could all agree on, but one of the reasons we could all agree was because we agreed not to use the word systemic racism. I think even just in the past 6 months from that, we've seen just about every province move forward enough that I think we would be able to get better understanding on that and better action on that. But it remains something I am committed to, and thank you so much for highlighting that vulnerability isn't just about age, even on COVID. There are many other factors that have to be taken into account better. Just look at a COVID map superimposed on a socioeconomic or a racialized Canadians map, and you see hotspots align. We have to respond to that in a public health way. Dr. Muga, thank you so much. On the family doctor thing, it was a commitment we made in our election platform in 2019 that every Canadian needs access to primary care doctor, whether it's doctor or a nurse, or they need that point of contact. And as we move forward through this pandemic, we've seen, particularly as we move towards mass vaccination, that having primary care physicians and family doctors, a core part of getting everyone vaccinated is going to be essential. Yes, there'll be a need for pharmacists. Yes, there's going to need for the institutions like the hospitals are doing it, but making sure that family doctors who are both most knowledgeable and most trusted. As you said, if I tell everyone the vaccine is safe, well, we know how people feel about politicians. Okay to a certain extent, but you're not taking medical advice from me, and it's probably a good thing. Getting doctors, especially doctors they know and trust, to say the vaccines are safe, they're effective, this vaccine is right for you, and we're going to follow you through it. Those are the kinds of things that help us get everyone vaccinated and blow away this vaccine resistance that unfortunately has been creeping in over the past years. That if there was ever a time to point out that vaccines cause adults, now is the time, and we'll really keep pushing forward on that. Ms. Mike Nakumik, for your comments. Thank you so much for highlighting. We are pleased, and Dr. Howard as well, you pointed this out, the decision we made around sending the Moderna doses to not do it tiered by age, but just vaccinate entire communities, entire populations in the north, so we didn't have to sort of keep coming back as the age ranges expand, I think was the right one. But obviously, it comes with a whole bunch of challenges, Indigenous languages, is a huge priority to us as a government, and we need to do better on that. So I hear you very much, and I will make sure that we're following up on ensuring better appropriate language supports on delivery of vaccines, but also making sure that we are continuing the flow of other medicines to the north, and looking at creating institutions. The heartbreaking stories of young women who have to go south to have their babies without families, without supports around them, out of their communities, out of their language, out of all their traditions. It's just no way to start a family, start a life together. We need to fix that. We've been working on it, but there is much more to do, and we are very, very aware, and we're working in partnership with Indigenous voices leading the way on how we can get the right solutions for different communities, for different regions. And finally, Dr. McQuarrie, thank you for highlighting the challenges that pregnant women are facing around vaccines. It's one of those situations where you realize sort of the marginalization of certain groups, and the scientific community that said to me many times, well, we'll understand what happens around pregnant women because there will always be women who got the vaccine without knowing they were pregnant yet, and then we can follow them. Well, yes, that allows for a certain awareness, but it's one of those things that I realize that if looking back in history, if men got pregnant, we'd probably have much more robust follow-ups and studies on effects on pregnancy of various drugs, and we just have to catch up to a system that still discriminates, unfortunately. And yes, people in Nova Scotia and Atlantic were very effective in many different situations. Part of it was the bubble, but part of it also, I had the opportunity to speak to the Dartmouth Health Centre a little while ago, and they pointed out that it wasn't just about being lucky; it was about doing the right things. Health centres and physicians and practitioners across the country have been doing the right things and learning from each other. And I really want to thank you all for everything you've been doing. Patty, I think you wanted to say a couple of words, but we have to keep it short because we got to get to more things, and I probably spoke too long there. I'm sorry.
There's lots happening, and I just wanted to say that to Dr. Saxinger and others that we are working with provinces and territories to figure out and to better streamline the data, including pan-Canadian data system around vaccines as well. It's not easy, as the Prime Minister mentioned. Not only do the provinces have the right to deliver healthcare in their jurisdictions, they guard it jealously, but we've made a lot of progress, I will say, given that everybody's understanding that this is of critical importance to their own populations. And I'll just say to the Prime Minister, if men got pregnant, women would run the world. And we would be talking about how we add more men to politics and how we get more men in STEM. But I'll leave that for another day. Former status of women minister, you can't beat it out of me.
Thank you, Prime Minister Trudeau, and thank you, Minister Hajdu. At this stage, we're going to move to our second section, which is to talk about patient and caregiver advocacy and issues of equity and diversity. Some of those issues we've already discussed. But we're going to hear from 4 panelists. And because we're running a little bit short of time, I suggest that we then move on to our third section as well. And so we'll hear from those last 3 panelists who are additional healthcare providers who are part of our kind of push for collaboration with all healthcare providers. So if that's okay with everybody, we'll proceed with the next 7 speakers. So on that note, we'll start with Dr. Gillian Horton, who is an internal medicine specialist in Alberta.
Very close, Winnipeg, but I think it's colder.
Manitoba, sorry. I was just frazzled.
In -40, it all looks the same anyway. So thank you so much. So I want to start by highlighting 2 key points about Canadians living with addiction when it comes to the vaccine rollout. So firstly, these folks need to be high priority. They have more concomitant health issues. They often have complex life circumstances and instability, and they often have more individual risk because of the situations that they find themselves in because of their addiction. And the second point is that people living with addictions are a diverse population. So no single strategy for vaccinating them is going to work. Briefly, here are a few key challenges when it comes to vaccinating this population. One we've heard about already, it is trust. It takes time to build trust, so we must, in this population, capitalize on existing relationships, especially to combat their considerable vaccine hesitancy. And secondly, identifying them can be a challenge. They don't come up on any census tool that we have. And they also have a very wide geographic distribution, so we are going to need to go to them. So how do we operationalize this? So firstly, the federal government really needs to strongly promote the prioritization of this group. And secondly, we need a multiple door approach. We need to ensure that any contact point we have with these folks is an opportunity for us to vaccinate. We need to reduce barriers, things like transportation, ideally down the road, no two-part vaccines for this group, and not booking them appointments at 7 a.m. at vaccine supercenters. And finally, to combat hesitancy, we need a national educational blitz that is driven by input from members of this community and also by those who provide care to them. So just finally, the pandemic, as you know, has been a devastating blow to people who are living with addiction. And perhaps this is an opportunity for you as the Prime Minister to tie some of the provincial asks coming into you with some asks of your own, perhaps legalization and pressuring certain provinces to allow for supervised consumption sites. We know that the healthier we can make this population, the more likely we are to get them vaccinated. And one thing that the pandemic has shown us in spades is that all of our health is interdependent. Thank you so much.
Thank you, Dr. Horton. I will now introduce Maggie Carestecchi, a community caregiver advocate in Ontario, and Amy Ma, a patient advocacy expert in Quebec.
Thank you so much, Amy, and thank you, Prime Minister and Minister. I'm one of more than 9 million caregivers in Canada who care for sick, frail, or disabled family members, friends, and neighbors. We're essential to their well-being, and our role should be reflected broadly in health and public policy, yet it isn't. Those of us who care for people at home are isolated and cut off. Many of the people we care for haven't left home since last March. They can't leave home to get a vaccine. We don't know when or how we will get our vaccines. We don't even know how we will know when it's our turn to get our vaccine. I'm of course anxious to get vaccinated, but like many caregivers I speak with, I don't particularly want to be at the front of the line. What we do want is clear, consistent information we can trust that's brought to us through primary care in our communities. What we do want is to know when we and those we care for will be prioritized. What we do want is to see ourselves in a transparent and equitable strategy that recognizes and addresses our unique situations. In it together should be much more than a hashtag. So I encourage you to ensure caregivers are included as key contributors to local vaccination planning. Mr. Rogers would refer to caregivers as helpers. Prime Minister, right now, we, the helpers, are struggling, and we need your help more than ever. Thank you.
Thank you, Minister Hajdu and Prime Minister Trudeau for this wonderful occasion. People with disabilities are quite vulnerable to COVID-19, but many provinces, including Quebec, have failed to prioritize them for vaccines and prioritize by age instead, focusing on people age 60 and over. Young high-risk people exist. If you are high risk, you should be high priority. How can we ensure the government is transparent about prioritizing different groups for vaccination in terms of equity? We need to pay particular attention to the disabled, other marginalized groups such as prison inmates, as well as those in congregate settings, including mental health facilities and supervised residences, and the people who work in these places. My suggestion is that we involve people from these marginalized groups, such as the disabled, as well as their caregivers on vaccine rollout task force across the country. Lastly, I want the government to be transparent about justifying delays exceeding the recommended delays between the 2 vaccine doses, and that this in no way will impact their efficacy. What's your plan B if it does? Thank you.
Thank you, Maggie Karastecci, and thank you, Amy Ma. I'll now introduce Dr. Vivian Stamatopoulos, an accomplished healthcare scholar and leading advocate in Ontario for long-term care residents and their families.
You're too kind. Thank you. Hi, everybody. Hi, Prime Minister and Patty, Minister Hajdu. So I'm sure you all know the problems with long-term care, and the vaccine rollout in Ontario with respect to long-term care and retirement housing has been no different. Our province has failed to properly protect these individuals, both seniors and persons with disabilities in these facilities. So we've administered, upwards of 400,000 doses of the vaccine in Ontario, and yet we still have failed to completely vaccinate all long-term care residents and retirement home residents. And keep in mind, we've had more than enough time and vaccine to provide both doses to every single individual across both these sectors, yet people are still waiting. And that leaves out the fact that older adults in the community have for some reason curiously been excluded from the first stage of vaccination in Ontario, which we know is dangerous and contrary to NACI guidelines. But what I'm most concerned about right now is what happens when the vaccinations are complete, because some elected officials, particularly in my province, seem to think that vaccines are the cure-all for the problems plaguing long-term care. And I want to be clear on something. While the vaccines, sure, will decrease COVID-19 mortality, they do nothing to address the ongoing abuse, neglect, and corruption in an increasingly privatized long-term care industry. I've spoken to hundreds of families over the course of this pandemic, and the things that I have heard will keep you up at night. They keep me up at night. You've read the military reports. I can tell you with certainty that those same horror stories were playing across at countless long-term care homes across the country, and they continue to this day, with no consequences to the bad actors whose negligence contributed to the largest mass casualty in our collective long-term care history. Over 11,000 residents have died to date. I know you raised the issue of national standards earlier this year, and I know you were having talks with the premiers. So I would love to know, we would all love to know, what is the status of those talks, and are we any closer to having national standards in long-term care? Thank you.
Thank you, Dr. Stamatopoulos. I now will introduce Dr. Naheed Dasani, a palliative care physician and health justice activist in Ontario.
Thank you for the opportunity to speak with you today, Prime Minister Trudeau and Minister Hajdu. My name is Dr. Naheed Dasani, and I'm a palliative care doctor and the founder of the world's first mobile palliative care program for people experiencing homelessness, the PEACH program in Toronto, Ontario. I work on the front lines of the homelessness crisis, the opioid overdose death crisis, and now the COVID-19 pandemic crisis. People experiencing homelessness are some of the most vulnerable people in society, living on average over 25 years less than people who are housed, while facing deep inequities in access to physical and mental health care, social supports, and affordable housing. Throughout the COVID-19 pandemic, people experiencing homelessness have had worse outcomes compared to those who are housed. People experiencing homelessness are 2.4 times more likely to test positive for COVID-19, 20 times more likely to be hospitalized because of COVID-19, 10 times more likely to be admitted to ICU because of COVID-19, and 5 times more likely to die because of COVID-19. And this is despite major initiatives across the country, including specialized testing, tracing, isolation, and support strategies for this population. We must prioritize the over 235,000 Canadians who experience homelessness and who are at risk because they live on the streets or in congregate living environments. If we're really all in this together, we will do this. While some Canadian cities have already started to prioritize those experiencing homelessness, as a country, there should be more consistency. I support the Canadian Alliance to End Homelessness in their call to action to call on federal and provincial governments, COVID-19 vaccination task forces, and health system leaders to prioritize the vaccination of people who experience homelessness, those staying in shelters, and the homelessness and housing sector staff who support them as a matter of urgent public health protection. The Canada I know and love takes care of our most vulnerable. We have a moral and ethical obligation to do this, and to do this now. Thank you.
Thank you, Dr. Dosani. I have shivers going down my spine listening to every single person. So we're going to skip ahead now to segment 3 to hear from 3 more important partners whose voices haven't been heard. And then I promise we'll get back to the Prime Minister and Minister. Thank you. So we'll turn now to Kristen Watt, a pharmacist in Ontario.
Prime Minister, Minister Hajdu, I would like to acknowledge that I'm speaking from Treaty 72 land, the land of the Saugeen Ojibwe First Nation, and the privilege I am afforded as a Canadian on this land. Today I speak to you as a community pharmacist in rural Ontario, and I come with 3 asks. I ask first that the federal government review the Controlled Drug and Substances Act exemptions that were granted to pharmacists due to COVID-19 and make them permanent. Myself, I was able to prescribe and extend prescriptions for palliative care cancer patients, as well as for my opioid agonist therapy patients, to ensure continued care and reduce risk from street drugs and possible overdose. Next, I would be remiss if I neglected to ask the federal government to engage more directly with pharmacists in their endeavor to provide pharmacare for all Canadians. In the 2019 report by Dr. Eric Hoskins, it is notable that there was no pharmacist, the very professional that will be tasked with implementing any such program, on that committee. At a time when financial pressures are most heightened, I suggest we Canadians consider a gap coverage program. The pressure on the drug supply system in a primary payer public program will be immense and result in decreased drug supply and increased work for all sectors of our health system and a detriment to our public health. Please engage with pharmacists as you move forward in this program as we build back better. And most importantly today, I ask that the federal government focuses energy on downward pressure to the provinces in the utilization of the resources provided. Point of care rapid antigen tests, vaccines, and federally provided dollars need to get to the ground level, to primary care providers and to pharmacists. Pressure from the federal government onto the provinces to provide a transparent process for those delivering public health is really crucial at this time. The success in utilizing pharmacists as part of the vaccination team was realized on a grand scale during the 2020 flu shot campaign. Locally, I'm on the COVID-19 vaccine distribution task force and am in talks with our municipality to provide as many vaccines to as many people as I can. Our rural region is over 10,000 square kilometers with 2 public health offices, 12 rural hospitals, but served by 68 community pharmacies. Pharmacists have pivoted in so many ways to continue to provide care to our patients in areas of public health and primary care. Most Canadians live within 5 kilometers of their pharmacy. We are accessible, we are ready, we have, and we will continue to be part of the solution. Thank you.
Thank you, Kristen Watt. I now introduce Abiola Tajani, a personal support worker in Ontario.
Thank you, Amy. Thank you, Mr. Trudeau. I'm a personal support worker. I work in Ottawa. Most of the time, our contribution is more or less overshadowed or look insignificant, like compared to the licensee or people who are the registered nurse. And most of the time, we contribute most to the care of the resident. So my question is about the way the vaccine is being rolled out in the nursing home. We spend most of our time care in nursing home. It's like our second home. This we got my colleagues from the way I work. We got the first shot from the way we work, but the second dose we have to go out to get it, and we don't even know what time is we getting this because of the shortage in supply. We want to know, are we getting it in the way we work, or we have to go out to get it? Sometimes we spend most of our time in the facility we work. Most of the time we work 16 hours a day in order to get care for the resident we care for. And secondly, in the beginning of this vaccine, the Prime Minister make a promise to compensate anybody that get complication or get sick from taking the COVID vaccine. So this compensation, we want to know to what extent that compensation, where are they getting it? Is it from EI or from the Ontario, from WSIB? We like to know about that. And also, I'm also a president for my local, and I want to know, because the union want to know, we have a lot of people that are COVID assistant that they don't like to take a COVID vaccine for one reason or the other. As of today, there's no law or any legislation that mandatory the COVID vaccine to be taken by anybody. Is there any way these people are to be protected for not losing their job because they don't want to take the vaccine? So, and if this panel permitted me, I would like to thank the Liberal government for the sensible and compassionate immigration strategy for the refugee during this COVID pandemic, particularly for those who are working tirelessly in the healthcare sector. We really appreciate the government for looking and taking care of those refugees during this pandemic time. Thank you very much.
Thank you, Abiola Tijani. I now introduce Leahy Spiegelman, a midwife in British Columbia.
Thank you, Prime Minister Trudeau and Minister Hajdu, for the opportunity to speak with you today, and to Dr. Kaplan-Murth, Amy Varley, and the panelists for inviting me. I'm privileged to live and work on unceded Squamish territory here in rural BC. I'd like to speak about how midwives across Canada can play a role in our country's COVID-19 vaccination strategy. As care providers who traverse both acute and community care settings, midwives have a unique capacity to deliver vaccines across regions, as well as into remote and Indigenous communities. Along with our colleagues here today, midwives are keen to support Canada's vaccine rollout plan. As part of an expanded primary care workforce, we can administer COVID-19 vaccines and contribute to vaccine equity across this country. However, midwives have been largely left out of pandemic relief and pandemic planning measures. Part of the conversation around vaccine equity is necessarily about caring for people who are not prioritized for vaccines. In perinatal care, that refers to most of our patients. Despite being at risk for severe disease due to COVID-19, pregnant people are not prioritized for the vaccine. Therefore, it is ever more important that our government protect this population from exposure to the virus. Midwives across the country are poised to support this challenge. Access to midwifery care can help reduce pressure on hospital resources and support COVID-19 containment measures by facilitating early discharge from hospital and by enabling families to receive essential services in the safety of their own homes. For many families in rural, northern, and Indigenous communities, access to midwifery care may be the only way to avoid traveling long distances to receive prenatal care or to give birth, thus avoiding the serious risk of COVID exposure, as in the tragic story that Nancy Mike shared. Midwives address vaccine hesitancy with birthing families, and Indigenous midwives in particular provide culturally safe care and information to Indigenous families, improving vaccine equity across the country. Prime Minister Trudeau, will you and the federal government encourage our provinces to support and mobilize the midwifery workforce to continue to provide care for families close to home and to participate in our country's commitment to vaccine equity?
Thank you, Leahy Spiegelman. I now invite the Prime Minister and Minister Hajdu to respond to all of the colleagues.
Thank you very much. Some just extraordinary questions and perspectives there. I really want to say thank you to all of you. I'm not going to be able to get to all the questions in as much detail as I would like, but Dr. Horton and Dr. Dasani, I mean, addictions and people living with homelessness, we know that they are so easily overlooked and so often slip through the cracks, not just because we don't engage, but because it is hard. It takes effort to get out and find and support, and there is such mistrust of authority, of institutions, and there have been such failures in the past. I really like, Dr. Horton, the suggestion on one dose. We know that the Johnson & Johnson, which is under analysis right now by Health Canada, might be a solution we can look at for particularly mobile or vulnerable or difficult to access populations. That's certainly something that I know we're going to be looking at, but how we can actually make sure we are going out to meet these most vulnerable people where they are is going to be particularly difficult and important, at the same time as we know that there is not a one-size-all metric or method, but support of the community organizations and individuals like both of you who are there and trusted the way a system in general is not trusted. You are going to be essential allies in doing this, because it is about obviously caring for our most vulnerable, but it's also about making sure we are eliminating this virus from places where it is easy to see it spreading through not just populations, but the whole population. Ms. Karastecki and Ms. Ma, thank you very much. We don't say thank you often enough to you or to Mr. Tijani for the direct and personal work that you do. And the highlighting that a caregiver who's been focused on someone who's been shut in since last March is themselves living extremely limited circumstances and is extremely vulnerable. We absolutely need to make sure that you are getting the support you need and the priorities you need. We will continue to listen and to work with your various advocacy bodies and experts in pushing on provinces and pushing on the things that we can do as a federal government to better support, to better recognize the foundational role you have in caring for our most vulnerable. It is not, as we move, I think, rightly away from a heavy institutionalized version of delivering care to something that's much more personalized. Your roles are going to be far, far more important, but we need to make sure that that is recognized, that is valued, and that you are given the supports you need to continue to do something that I know you don't do it for the money. You do it because you care deeply about service and about caring for the most vulnerable, and we are all incredibly lucky as a society to have you, but we all too often end up taking it for granted. So thank you for highlighting those issues. Dr. Stamatopoulos, yes, the wake-up call that so many Canadians have had on how we care for elders, our parents, our grandparents, what we've done and not done as a society in terms of ensuring that end of life and retirement is done in dignity and with proper support, and that someone who's worked all their life to contribute to this country be able to spend their retirement in safety and in dignity. This pandemic has not created the problem. It has highlighted a long-standing problem that we can't now look away from. And I am worried that once we get everyone vaccinated and we try to move on to the next thing, we will go back to not thinking too much about the uncomfortable reality far too many seniors live in across the country. And that's why I am committed to national standards on long-term care. Now, I know it's inexplicably become a bit of a political football, which, quite frankly, I don't understand. I understand why the provinces who have been in charge of this for the past decades, and quite frankly, there's nothing new about the fact that long-term care hasn't been adequate, particularly for lower income populations for many decades. There have been many reports and stories and outrages and heartbreaks come through there. We need to make sure we are holding ourselves to account as a society. And my plan is not, the federal government has all the answers. We're going to tell you how to care for your seniors. We don't do a lot of care for seniors in the federal government. It's obviously mostly a provincial responsibility, with the exception of some Indigenous communities where, quite frankly, we haven't done as great a job as many other places. So we're certainly not ones to say, the federal government has all the answers on long-term care standards. But you know what? There are some areas, I think of Nova Scotia and the northwards outbreak that happened there, where it was serious, but the response and the learning that happened, made sure that we haven't seen any sorts of problems. And infection control and prevention and things like that are always sort of secondary, need to be put to the front, particularly during a pandemic. Our approach at the federal government is first of all trying to figure out best practices with provinces that do it well. I mean, what did Nova Scotia do so well around northwards that can be shared with the rest of the country? What is BC doing around certain aspects, or what is Manitoba doing around others? Like there are best practices that we should be sharing and maybe come together to and hopefully come together to establish a national framework. The simple bottom line for me is, no family member should worry about their parent in a home because of the province they live in. Nobody should have to move across the country, as we do know families move because of inequality in prescription drug coverage, which is another whole conversation we have. Oh, the rare disease drug that my son needs is available in another province. So we're going to move because we can't afford the hundreds of thousands of dollars it would cost over the coming years to treat them. Well, we shouldn't have people shopping across the country for jurisdictions in which they can put their elders, because if they leave them in their own community elder homes, they're not going to get the right quality of care. Every single senior in this country deserves the same quality of care, deserves the best quality of care. And I think this pandemic and the resulting tragedy has highlighted that that is not the case right across the country or even within different provinces. And the federal government does have a responsibility for the life and well-being of every citizen. So it's not a matter of, oh, federal jurisdiction should stay out of senior care. No, we have a responsibility to make sure all Canadians are safe. So we are going to start by working with those provinces who want it and who are eager to it, because there are a number of provinces who said, absolutely, let's figure out what the best possible standards are. We want to offer that to our citizens. And those provinces who don't want to be part of that, well, I think their citizens will be asking some very, very difficult questions about why their parents and grandparents don't deserve the same quality of care that people are getting across the country. It is something I am absolutely passionate about. It is not something about the federal government trying to impose itself on various jurisdictions. It's about making sure that jurisdictions are doing everything they can alongside their neighbors and drawing on their neighbors to serve elders the best way possible. It's coming along, not as fast as I'd like, because of course the provinces don't like the idea that someone would be telling them what to do in their area of jurisdiction. But there has been a failure of long-term care generalized across this country, worse in certain areas. And if we don't act on it, it's not just the federal government or provincial governments who are accountable, it's all Canadians who will be accountable for failures ongoing, because nobody going forward is going to be able to say, oh, well, we didn't know it was that bad in long-term care centers. Well, 11,000 deaths tell us otherwise, and the proportion tell us otherwise. We're going to have to do better. Sorry, I'm going longer than I wanted to on this one. Ms. Watt, pharmacists are going to be essential partners, not just in this pandemic, but increasingly in the move away from institutional care towards more personalized care. Individuals being able to care for their own health. I hear what you say about extending the measures for pharmacists. I will absolutely look at that. And making sure we're engaging you in rapid tests. We've sent over 19 million rapid tests to the provinces. Some are being used, not all. I think we're now looking at, well, can we instead send rapid tests directly to the pharmacies across the country? Will that cause provinces to get upset, or will it spark people actually using on these things? I mean, there are conversations we have to have, and you are going to be an essential partner in it. Mr. Tijani, again, thank you. In terms of mandatory vaccines won't be mandatory. That's not the way we do things in Canada. But at the same time, the decision to not get vaccinated could have public health consequences, particularly in working in certain settings. And therefore, we're going to do everything we can to be respectful of people's choices. But the safety of all Canadians need to come first. And if someone does choose to not get vaccinated, well, that might have an impact on different factors in their lives. I haven't dug into that a whole lot, but I think that's part of a responsible conversation that has to be had about how we keep people safe. The vaccine compensation regime is one that we need to have, but it's not something that we're expecting to need to use particularly much, because the vaccines have been approved by Health Canada as being safe for all Canadians. But it is there as something that is there in case something does go wrong. And in terms of second doses, it just makes sense to get those second doses, to particularly people who are working 16 hours a day, to where they are working. But obviously, that's not the federal government's decision. But it will be made easier by the fact that we are going to start getting the vaccines in the hundreds and hundreds of thousands of doses in the coming weeks, and into the millions in the coming months. And the accessibility and availability of vaccines and the desire of getting as many people vaccinated as quickly as possible means we're going to be able to get it. There was also a question about the delay between doses that someone brought up. Oh yeah, that was Ms. Ma who brought that up. The way vaccines often work is more time. Sorry. Dangerously in danger of going beyond my my knowledge, my medical knowledge. But as I understand from many medical professionals, vaccines often, when you stretch out that second dose later, it provides better protection as a boost. But of course, the longer you take between the first dose and the second dose, the longer time you have only the protection given by the first dose. If that first dose is extremely high protection, well, that's maybe not as bad. If it's medium protection, maybe you want to keep it a little closer. These are delicate decisions that are not best made by Prime Minister, no matter how much he is interested in this stuff and geeks out. They are decisions best made by professionals, which is why we turn to the NACI task force on immunization to make determinations around what is the best way to do things. But you can know we will not be allowing or encouraging timelines or spacing that is not what is recommended by the very best public health experts, taking all sorts of factors into play. And again, the fact that we are moving into much larger amounts of vaccines coming means I think it's going to be less of an issue and a preoccupation. And Ms. Spiegelman, thank you for what you do the midwifery industry or community are extraordinary supporters of health and well-being. And yes, you are part of the challenge. We talked about part of the solution. We talked about the challenge facing pregnant women who are at greater risk of complications because of COVID, and yet not as accessible to vaccines as other populations. We need your help in making sure we're keeping people extraordinarily safe, particularly when they're pregnant, because we need them and their baby to be as healthy as possible once we all get through this, because we're building a bigger future and a better future for everyone. So thank you all so much for your questions. I'll now turn to Patty to add or correct me, as she sometimes does, on things I might have gotten wrong or overstepped.
Just on the gender thing, I couldn't resist, Prime Minister, earlier. Well, listen, I just want to thank everyone in particular. I mean, the Prime Minister said a lot. I'll just really very quickly say, I want to thank people on pushing for the rights of people who live, who experience homelessness and who use substances. Many of you, if you have read my bio, and I'm not presuming that you have, will know that's the space I came from prior to politics. And it's so encouraging to see people continue to advocate for people who are experiencing homelessness and using substances. And I will just say, we're actively in the space of shifting a conversation in this country from one of criminalization to one of public health around drugs, alcohol use, and other substance use. And so you can read the headlines and you can follow along, but it does tie into what Kristen is talking about, the exemptions to pharmacists and the I think Dr. Dasani and Dr. Horton talked about pressing provinces for safer consumption sites, for more compassionate legalization, decriminalization spaces. There's a lot of work happening in that space. And of course, the federal government under the Prime Minister has been turning the dial back towards compassion for those particular population groups. Since we were elected in 2015, it's been a long journey, but we've had some really pivotal moments. And I appreciate the ongoing conversation and pressure, quite frankly, to continue to work rapidly, especially in the areas of housing and other social determinants of health. So thank you, and know that we're with you and that we are working with provinces and territories. Many of the things that you talked about, sadly, are controlled by provinces and territories, but at the federal government level, we continually work both on a downward pressure way but also in an incentivized way through billions of dollars through COVID relief and safe restarts and research and, stepping in through, for example, Canadian Red Cross supports and epidemiological supports through our rapid response program. We're going to continue to do that. We're going to continue to try and have those really strong conversations around vaccines and adhering as closely to the NACI guidance, which is going to be uncomfortable for some folks because, of course, there's a lot of stakeholder groups saying, well, I'm an essential worker, I'm a specific union, I work on the front line in this particular way, we should be next, we should be next. And so it's going to really take all of you to kind of try to help the provinces adhere as closely to that national guidance, which is generic enough to fit in provincial priorities, but I think specific enough to get to the people most at risk and really achieve our goal of saving lives through vaccination and then hopefully the diminishment of spread. And then finally, I'll just say that the stuff on long-term care, the Prime Minister is absolutely right. This is a priority for us. It's not just standards, though. As I'm learning more about standards, you can have all the nice standards in the world if they're not actually somehow upheld and enforced and actually people are accountable for those standards. They're essentially another useful, but yet another essentially report. And that's the last thing I want is to recreate things that, for example, Dr. Sinha has just recently done, that the Standards Council of Canada are actively in the space of. What we need is to figure out how we take those standards and then how we incent/enforce those standards. And I hate using the word enforcement, but there's got to be some kind of commitment by the provinces and territories to use those standards, monitor those standards, and make sure that they are actually applied in every long-term care across the country, or else we won't get to the vision that the Prime Minister has. So thank you very much. I look forward to your ongoing advocacy and your ongoing encouragement and your expertise. And I've written down many names that I'm hoping we can connect on a bilateral level. So thank you again.
Before we wrap up today, I'd like to invite the Prime Minister and Minister Hajdu if you have any other final closing statements.
I think we sort of wrapped it up in those remarks there. I just really want to say thank you. Thank you to all of you for your dedication to service to Canadians, the long hours all of you have put in, the personal sacrifices as well. I mean, even as all Canadians are worried about their kids going to school and their job and being locked down and all these different things, you're dealing with all that while at the same time you're going to the front lines and supporting our most vulnerable with the same stresses, the same anxiety that everyone's feeling multiplied, because you actually get to do something about it and you're actually saving lives directly. It is extraordinarily inspirational to me to be able to spend a little time hearing you and seeing the continued fire, the continued drive, the continued commitment, and the continued willingness to keep pushing hard on me, on Patty, on provincial and territorial governments, on municipal leadership, and on Canadians. We need to do better. We need to be better. And you are people who consistently push us in that direction. And I thank you deeply and demand and request that you continue to push really hard and point it out when, as a society, as institutions, we're not meeting the very high mark you set for yourselves and have every right to set for everyone who works alongside you and has to give you the tools to be able to do what you do. So merci beaucoup, mes amis.
Thank you, Prime Minister. We accept your demand. And thank you, Minister Hajdu, as well as thanking all of you as participants today, as well as our viewers. And thank you, Amy Varley, for co-moderating with me. Today's panel was an example of the diverse voices that should be at every decision-making table. This is only the beginning of the collaborative conversation that we hope will continue. So we are here if you need us. Thank you.